Hello and welcome. Today we're going to break down a really crucial part of our anatomy, the thoracic aorta. And don't worry, by the end of this, you'll have a super clear and simple map of its path and why it matters so much. So, if you're a medical student, I'm sure you know this feeling. You're trying to trace the aorta and all its branches, and it just feels, well, totally overwhelming, right? Our whole goal today is to make it simple, one step at a time, so you can picture it perfectly. Okay, let's start right at the beginning. Okay, so first things first, what is the aorta? The easiest way to think about it is like the body's main blood highway. I mean, it's the superhighway that takes all that fresh oxygen-rich blood from your heart and sends it out to literally everywhere else in your body. All right, let's get just a little more specific. The aorta is the biggest artery in your entire body. Its whole job is to grab that oxygenated blood from the left side of your heart, the left ventricle, and distribute it everywhere. So if you remember one word for its function, it's distribution. Now, to really get a feel for the aorta, let's actually follow the blood on its journey. We're going to focus on the part in your chest, which we call the thoracic aorta, and it's actually made up of 3 distinct parts. So let's trace them one by one. Okay, part 1. The journey kicks off with the ascending aorta, and just like its name says, it ascends, or rises up, right from the left ventricle of the heart. It's pretty short, only about 5 centimeters long, but it's so important because the coronary arteries, the ones that feed the heart muscle itself, branch off right here. Next up, after going up, the aorta makes this big curved turn, kind of like a candy cane. This is the famous arch of the aorta. Think of it as a major intersection. It arches right over the pulmonary artery, and it's the launching pad for all the big arteries that go up to your head, your neck, and your arms.
And coming off this arch are 3 super important branches. This is high-yield stuff for exams, so here's a great way to remember them. Just think A, B, Cs. The B is for the brachiocephalic artery. The C is for the left common carotid artery. And the S is for the left subclavian artery. ABCs? Got it? Super helpful little trick.
All right, so we've gone up and we've arched over. What's next? The journey continues downwards, straight through the chest. This is our third part, the descending thoracic aorta. It travels down right alongside the spine, and on its way, it sends out little branches to feed the chest wall and all the organs inside the thorax. Okay, so now we know the normal route. But why is this so important to know for, actual patients? Let's take a look at what happens when things go wrong on this major blood highway. There are 2 main problems we see with the aorta: aneurysms and coarctations. An aneurysm is when a weak spot in the aortic wall bulges out, kind of like a balloon. It's a widening. On the flip side, a coarctation is the exact opposite. It's a narrowing. Imagine someone pinching a garden hose. That's a coarctation. And this is where knowing your anatomy really pays off. Let's say an aneurysm, that bulge, forms in the aortic arch. Because of where it is, it can start pressing on things around it. For instance, if it presses on the nerve that goes to your vocal cords, you can get hoarseness. We call that dysphonia. If it pushes on your windpipe, you'll have trouble breathing, or dyspnea. And if it squishes your esophagus, you'll have a hard time swallowing, which is dysphagia. See? The symptoms are a direct clue to where the problem is. Okay, we've covered a lot, so let's boil it all down to just the absolute key points, the stuff you really need to lock in for your exams. First, remember the thoracic aorta has 3 parts: ascending, arch, and descending. Second, it all starts in the left ventricle, carrying that oxygen-rich blood. Third, don't forget the 3 branches of the arch. Remember your ABCs. And finally, know the 2 big problems. An aneurysm is a widening, and a coarctation is a narrowing. You nail those points, you're golden. All right, for our final recap, if you walk away with just one single thought, let it be this one. The aorta is the vessel that carries oxygen-rich blood from the heart on a 3-part journey. It goes up, it arches over, and it comes down, all to supply your entire body. It's that simple. It really is the body's highway for life.